And welcome back. Thank you so much for staying with us. It's now time for that conversation that I promised you earlier on endometriosis. Bearing in mind it is the Endometriosis Awareness Month, and it actually affects around 176 million women worldwide. Hence, such a very important conversation to have. Remember, you can engage us on our social media handles on Twitter at KTN News KE, at Grace Career KE, and of course, we're asking you, do you feel there is enough awareness on endometriosis? And my panel is already with me in studio. To my right, I have Mukami Maora, who is an endometriosis patient, Dr. Charles Muteshi, a fertility expert, and Elsie Wandera, my extreme right there, who is the founder, Endometriosis Foundation of Kenya, and also an endometriosis patient. Thank you so very much for joining me. Thank you. I'm told the theme is yellow, and I wish you told me earlier. I've been yellow today. But Elsie, you're in yellow, so I think let's start with you. Just give us your story and how it started up to the point of diagnosis.
Right, so I started my period when I was about 13 years old, but the pain started when I was 15. And I was only diagnosed when I was 26, so that's about 8 years of a delay. So I was in pain. I used to miss class. I used to usually get rushed to the ER to get some injections and pain medications, and that's how I survived for the 8 years until I discovered like what it was. But it was really just very painful, debilitating period pain, which I usually say now we shouldn't allow our teenagers to go through.
Mukami?
So for me as well, similar story actually, but I actually had my period very early. I was around 11 years old, but the pain began for me, I think, when I was around 14 years old in high school. And I remember almost every month I used to go, to see the doctor because either the flow was too heavy, my menstrual cycle was also irregular. So it took also around 7 years, I think, when I was around 21, for me to get proper diagnosis. There was a lot of misdiagnosis, a lot of miscommunication, being told I only have hormonal imbalance, I'm only growing up, so it's normal. Rather, I feel like also Elsie has also experienced the same. You're being told it's normal. Period pain is not normal. You're not supposed to miss work or school because of period pain, and that's one of the telltale signs, rather, I can say, for you to actually just tell if you have endometriosis or not.
Okay.
Yeah.
Now, there are two striking characteristics here. Elsie, your pain started when you were 18. You got the correct diagnosis at 26. Mukami, 14, the pain, but the diagnosis at 21.
Yeah.
Dr. why does it take so long? Why do we have to have, misdiagnosis when it comes to endometriosis? Why take more than 7 years to correctly diagnose it?
Unfortunately, endometriosis is misunderstood by many people, and because of the presentation of pain during menstruation, that's been normalized, and girls find it difficult when they speak to their friends, their relatives who have previously perhaps had pain, and they're just told to soldier on because every woman has pain. Unfortunately, lots of them who have pain may have endometriosis, and it may take a long time even for their primary physician to have that suspicion to refer them appropriately.
There's something Mukami said about your periods should not, period pain is not normal. That is what she said. Is it true?
Absolutely, and that's what we're aiming to change, because even though nearly all women may have some degree of pain, how much pain you feel, you can only tell by yourself. So you couldn't tell anyone else that what you're feeling is normal.
Okay. Elsie, let me come back to you. Let me take you back to, when you were 18, perhaps still in school. Did this by any chance, by any way, affect your productivity in school, your social life?
Yes. So I'll correct the age. So it was 15.
15,
18, yes.
Not 18. Okay.
So it used to be, I was that girl who was faking an illness in school, and that was the narrative. Like I was either faking illness to miss class, and so I remember also, like, in terms of just participating in school activities was minimized because I had this pain that would appear, like, and And also, like, I remember it actually impacted my the way I thought about myself, because people were there, making up stories about me, but I couldn't understand why people didn't believe that I was going through this pain, like it was legit. And that's why I think for us, we want to make sure that everyone who is struggling with this pain knows that their pain is valid, because the invalidation, being told it's normal, when I go to see a doctor, it's you're fine, you'll be okay, we just give you this pain medication and you'll be fine. And then when you give birth, you'll be okay. And that's the narrative a lot of young people are being told, young women, and most women who are suffering with endometriosis and period pain. The myth is, that if you conceive and you give birth, the pain will go away. But it's not necessarily the truth. So that was my journey in high school. So it was difficult, hearing that I was just faking my pain to get attention and to miss class.
Now, statistics are quite high globally. Dr. will be telling us about the statistics in Kenya here at home. But I want to know, in perhaps the school that you are in, if maybe you would discuss with your, say, classmates, were you, I don't know, could you say you were perhaps the only one, or were there other girls who you would say were facing the same issue that you were?
There were other girls, by the way, by all means, girls who had started menstruating at the same time. But because, talking about periods and the conversation around periods is really taboo.
Yes.
I mean, we live in a culture where, even talking about it today, and that's why even, just creating this awareness is necessary, because first we must destigmatize whatever is linked around period pain and women who are suffering with period pain. So it was difficult to talk about it. I couldn't talk about it with all my friends. Of course I had my best friend whom I could share with, but there was no one else I could confide in, except my mom. So I know my mom had told me that the period pain had been like in our family, so she would explain to me, don't worry, your auntie, your cousins, so I got, a sense that, this is like a woman's curse. Just because we're on our period, then it's mandatory for us to be on pain. So the fact that it's taboo, I think it was very difficult to bring up that conversation at that age.
Sounds genetic?
Yes, and Dr. Muteshi can talk about it,
definitely.
but according to the research that I have done, it is you're likely to get endometriosis if your daughter, like my daughter, is likely to get endometriosis because I have it. But Dr. Muteshi can talk about it.
We'll get to you, Dr. Mukami. I want to know if it also affected you in any way in your studies, because you are also in school, 14.
For me, I remember one characteristic I had. People thought I was lazy, and that's because I was always very fatigued and I was very tired. And I really, I was the last person to wake up, for example, for morning preps. So it really did affect me, and I thought I was not okay, and no one was really understanding me, no one was really listening to me. When I go see the doctor, they tell me it's normal. I remember I was actually even put on contraceptives, I think I was 16. Just to try and balance out my hormones, because again, misdiagnosis, I was being told that I had hormonal imbalance. So of course it was not I don't like my high school experience. It was not the best. I was always tired or unwell. So of course it did really negatively affect me, and also my studies. Concentrating when you're in so much pain, where you're so tired and you don't understand why, of course it's the worst. And you're growing up. That time you're a teenager and you're getting to know yourself. So of course there was a lot of emotional trauma and torture.
So, Dr. let me now come to you. Let's go to the root. What causes it? Elsie has mentioned about it being genetic, but expound on the genetic bit, and also what other factors could cause endometriosis.
We still struggle to understand what endometriosis is all about.
Dr. let me cut you short. Let's start with what endometriosis is, because I realize we could be having this conversation amongst ourselves. We know what it is, but perhaps there's a viewer out there who doesn't know what it is. So start with, what is endometriosis?
So in very, very simplistic terms, I think endometriosis is simply a descriptive term, which means the cells of the skin of the lining the womb are found outside the womb lining, and they're very similar to the cells that will be shed when a girl or a woman has her menstrual flow. It is thought that when this breakdown of endometrial tissue or womb lining tissue happens, then it may cause pain when it's located outside the womb lining. How it gets there is still a mystery, but we believe that perhaps because the womb lining is connected to the pelvic or abdominal cavity through the tubes, a bit of the menstrual flow that gets into the pelvis could implant and develop into endometriosis. That does not explain all the types of endometriosis we know, because endometriosis, unfortunately, is not one disease, but is a collection of symptoms which are characterized by the presence of these cells outside the womb lining. Now, what causes it is still battling scientists, but people working very hard day and night to understand. We have unraveled quite a few theories and mechanisms that explain perhaps the symptoms of endometriosis. We may not fully know how it comes around. However, as Elsie has pointed out, we tend to see girls and women who have relatives with endometriosis may have a higher chance of being diagnosed with endometriosis. There's no single genetic factor that can have a direct link. Studies have looked at different genes, for example, and I think we have about 8 or 9 candidate genes which are inherited in different ways. Again, we think these are associations rather than causations. It is likely if you have endometriosis, your relative might have endometriosis, but you don't have to panic that I may pass this disease on to my girl.
You don't have to panic, but then again, you did say it is likely. So is there something that can be done to avert that? I mean, for instance, with Elsie, she did say her daughter is likely to, have endometriosis. So is there something Elsie or perhaps the daughter can do to ensure it doesn't get to that point?
Just like any other chronic ailment, the sooner you make a diagnosis, the better you give someone a quality of life, you give them effective treatment, and you could stop its progression into becoming severe. The common narrative is girls and women have a delayed diagnosis, and in fact, we also know when they present to their doctors at the first instance, they may take up to 4, 5, or 6 visits before they are referred appropriately. So the delay in diagnosis is not only recognizing that menstrual pain is abnormal, it is also suspecting that a girl who has pain could be suffering from endometriosis.
You again said menstrual pain is not normal, but you see, there's that sort of discomfort or pain that I think all women feel at around that time, right? But again, you're saying period pain is not normal. So when do you distinguish between this, what I would call normal pain, allow me to call it that, and now this pain that shouldn't be there?
Pain in itself is not a pleasant experience, however intense it might be. So if you have mild pain or if you think you have severe pain, you wouldn't be able to use the intensity of the pain to judge whether you have endometriosis or not. When you experience some degree of pain, either around your menstrual periods or any other time in your cycle, then it may be best to seek a medical advice to exclude any other causes of the pain.
Okay.
Not all pain is caused by endometriosis.
So any form of pain, it's better to seek medical attention. Okay. Now, Elsie, back to you. You said 15, so it took 11 years for the correct, right? Yes, for the correct diagnosis. I want you to take us through those 11 years. How are they? Anytime you're on your cycle, how are they?
The best way that I can describe it, I felt like my uterus wanted to come out, because it was so inflamed. The pain was so much, and one of the symptoms and ways which endometriosis manifests itself is bloating. So I'd always feel a lot of pressure just in that pelvic area, and I would literally feel like you know, like it was so uncomfortable going to, you know, to the toilet, like for a long call. Like I dreaded it. In fact, I used to monitor my cycle, because I would know when ovulation is happening. I would literally feel the egg moving, and I got to know why, because there was like an ovarian cyst growing at the time, and I was being told that whenever there's any pressure, you feel like the egg moving. I could be wrong, but you know, Dr. Muteshi is here to correct me.
Sure.
But that, you know, it was uncomfortable. I would know, like I remember I used to tell my mom, I used to call her and tell her the eagle has landed, you know, like I would know, like I'm ovulating. Then leading up now to just the days when I would shed, I would go through very like excruciating pain, you know, around my bowel area, like where my bowel is, and around the rectum. And that's another way that endometriosis really manifested for me, and that's how I knew like it was not normal. And it was so bad that I would have to sleep on the floor, you know, for that cold effect, because my body used to be so hot, I think as a result of all the pain, that, you know, so it was completely crippling, and you know, like thinking about, like, because I was in a work environment, I would also miss work, and I remember like some of the questions my colleagues would ask me, and ladies for that matter, you know, would ask like, what period pain, like what are you talking about period pain? And the one thing I've always encouraged other women to know is that just because you have a normal period doesn't mean that everyone else's is normal. Because I've never known like a normal period, like, because even when I started menstruating, my periods were very irregular. So I don't know whether I have experienced like regular, painless, normal period. So there was that, you know, narrative and labeling around, you know, okay, so what period pain is this you're going through? Why can't you come to work? Why can't you continue working and just pop the pills and stuff like that? And one of the other thing I know, I was very dependent on pain medication. I remember I used to take, and I say used to because I had to stop, because I realized the effect and what I was doing was not helping my body. I used to take Voltaren, like a drug that, you know, deals with like bone pain, like, you know, and then have to also go to the ER. Like I would time it, I would know like just before my period starts, just before like a day or two, I would have to go in for a pain injection, that at least would steady to some type of sanity, but it was never guaranteed. Like there was nothing I would do to minimize the pain. It was just there.
I think now hence the need for the awareness, because
Absolutely.
most of the comments I'm getting is people saying no, few people are aware of it. That's actually just one of the comments here from our viewers, and also with the comment you made on your colleagues, especially ladies asking
absolutely.
you what sort of period pain is this.
Yeah.
So if we ladies are not even aware, then how about the men?
Exactly.
Yeah, there are lots of things you've said which I'll be getting back to later, but I want, before we take a break, Mukami, you could take us through your experience before the correct diagnosis.
Right.
Yes.
For me, as I mentioned before, my period started quite early, when I was around 11 years old. It was irregular at the beginning, but I was told again, it's normal because you're just starting out. So really, it's your body is still getting used to the fact that you're getting a menstrual cycle. So that went on until when I was around 12, 14 years old is when now the pain became very, it was a lot. It was a lot of pain. My flow was very heavy. And almost every month I remember I had to go to the hospital. And when I was around 16 years old is when I was put on hormonal medication. Literally I was put on the pill, rather, for lack of a better word, so that I can control my hormones, so that I can be balanced. And one of the ways you can also know you have hormonal imbalance is other ways it manifests itself. For example, I was also diagnosed with nodular cystic acne. It was very severe acne. So again, that's also a condition that was brought about by hormonal imbalance. So I had to change my doctor for this new doctor to actually realize, no, this is not normal, and for me to tell him my story. I was that girl in campus who would miss classes And even when I was working, people would understand, actually my bosses would understand, okay, Mukami is not coming today because it's that time of the month. And it was actually very painful. So until the tests were done, and for example, an ultrasound was done, where they noticed that things were not okay. Now, unfortunately, for endometriosis, for it to be correctly diagnosed, you have to go through a laparoscopic surgery, and of course, Dr. Muteshi will expound a bit more on that. So, of course, even that diagnosis is invasive in itself.
Sure.
It's not just, oh, let's maybe take an X-ray and then we know exactly what you have. Until you go under the knife is when they will actually really discover that you have endometriosis. So, of course, it was also a lot of pain, irregular menses, people not really understanding what you're going through because, you know, oh, is it the little cramps I also get that. And these are other ladies telling you, of course, like what else is saying. So they're not really understanding what you're on about. But for me, it was really painful. And also just telling someone, no, I'm not coming because of period pain. And for me, just to expand on what else you're saying, I would realize that I would get my period pains even 2 weeks before I actually get the period, or I would actually realize when I'm ovulating.
Okay. We need to take that break. Of course, we're back with more symptoms, diagnosis from the Daktari, and of course, more of your experiences, Elsie and Mukami, and also the Endometriosis Foundation of Kenya. We will be hearing more about that. But first, we need to take that commercial break. Do stay with us. We're back after a